A deadly cholera outbreak has struck Nepal's Birgunj, sending hundreds of patients rushing to local hospitals. At least about 3 people have died and over 300 others have fallen seriously ill, with many requiring intensive care. And doctors say that the outbreak began last week, but the officials only responded after days of delay. Now, health experts have blamed the contaminated drinking water and the poor sanitation conditions for the outbreak. The infection has spread across several wards of Birgunj metropolitan city. Experts are now calling this to be the most severe outbreak since the Jajalkot epidemic of 2009. They also warned that the government has become complacent after declaring the country to be open defecation free. The doctors are urging people not to treat cholera at home and to seek immediate medical care at a hospital. Now, health officials have admitted that the patients arrived too late and all 3 fatalities were brought dead. The critics are slamming the authorities for ignoring early warnings and failing to act swiftly. They say that hiding outbreaks and neglecting water safety is costing lives. With cases rising, Nepal's health ministry is now scrambling to contain the outbreak. The lab tests are underway to confirm the strain and to map the spread. And WION's Saloni Murarka has sent us this report from Kathmandu. Listen in.
The recent cholera outbreak in Nepal's Birgunj city that lies in the southern plains comes in the wake of prolonged drought in the district, and it is suspected to be the reason behind the outbreak. Scores of ailing patients have been admitted to intensive care units across the district. Healthcare officials link this outbreak to contaminated drinking water, poor sanitation and prolonged water scarcity. Experts, meanwhile, say that this outbreak has exposed gaps of government's preparedness and response. They say that the risk to waterborne diseases will not decrease until country's water and sanitation conditions improves and people have access to safe drinking water. Meanwhile, the province's health ministry has assured that medical teams have been mobilized, security support has been put in place, medication and medical equipments have been mobilized, and public safety measures have been put in place, along with strong intergovernment agencies at federal government and provincial level. The Birgunj metropolitan city, meanwhile, has extended the school closure for another 3 days in the wake of cholera outbreak. Saloni Murarka for WION World is One in Kathmandu, Nepal.